I think should be given top priority. You hear from the WHO, the World Health Organization, 1 in 4 people have a mental health problem. I have challenged this for years. I think we all have a mental health problem. It doesn't mean we have to go into hospital or have medication, but psychologically we all get a bit depressed at times, we get a bit anxious at times. And I think the great thing about celebrating International Mental Health Day is just making us aware, and also to address the fear factor. There's nothing wrong with having a mental health problem. It's a bit like cancer. People get treatment, they recover. Some people may need long-term care, need treatment for an extensive period of time. And some people fully recover. With mental health, you can fully recover, you can go back to work, you can live a normal life. And the people in Gibraltar should not be fearful of mental health, but actually grasp it and say, it's part of life, but what are we going to do about it?
In terms of services provided at the GHA, you've been very careful looking at everything that's available, looking where improvements can be made. Is there anything you can tell us about the work you're doing on the side of mental health care?
I think one of the big things we've done over the last 12 months was bringing a new mental health strategy. But okay, a mental health strategy is just a document for policy people. For the real people on the street, I think the big thing has been our crisis line. I'm amazed when I saw the number of people being admitted directly to our inpatient services in Ocean View who didn't need to be there. When I came here, and my background is a clinician in mental health, I would go to the wards and think, why are you here? And the response was, well, there's nothing else. You come into your inpatient wards. What we've done with our crisis line and using 111 and our crisis service, people have fed back to me. Now they know they can talk to someone. So they ring up. There's someone on the end of the phone saying, Mark, are you all right? Okay, do you need a service now? Or how about 9 o'clock in the morning, we book you in to see ourselves, be it a therapist or a psychiatrist, etc. Most people say, that'd be wonderful. All I want to know is someone's there. And we have seen a significant number of reductions in people coming into hospital and more people being supported by our community teams in the community. We need to do much, much more. But what we're doing is shifting the focus from inpatients to community. Because I would say to you and your listeners, you don't wake up in the morning and say, I'd like to go into hospital for a day. You want to be with your family, eating your food and supported from your loved ones. That's what we want to do.
Where do you see organisations like Clubhouse Gibraltar fitting into that chain? How important is what they provide here for those people in the community who do have mental health issues?
Clubhouse is vital. We're all partners. And if you ask ordinary person in the street, they don't want to look at badges, GHA, Clubhouse. What they're saying is, who can help us in our journey when we have a mental health problem? So Clubhouse to me plays a pivotal part, because what happens is when people are coming out of hospital, we refer them to Clubhouse, they make friends with Clubhouse. So again, they've got someone to help them recover, they have a friend. When they move out of Clubhouse back into the community, they know they still have a friend in the community. The one thing I love about Clubhouse, they're not judgmental. You come, you ask for help, you get to help. Without Clubhouse, we'd have big problems here in Gibraltar. So I think they play a marvellous role, it's very well led. And the feedback we get from people without Clubhouse, the potential would be we'd have more people coming into hospital. Although we may have different names, I see it just as one big mental health family and a team working together. We can't do it by ourselves, but we're more successful by working together.
So Dr. Geoghegan, you said that the focus is shifting from inpatient care to care in the community. Can we expect more announcements on that?
We will be making some more announcements about more exciting healthcare reforms over the next week, and we'll be letting you know about it. But yes, we need to transform services here. And I have listened to the community. That's how I learn. I listen, I come back, and where I can make changes, we will make changes. And I'm really looking forward to announcing them next week.